Hello and welcome to my webinar. This is Dr. Mark Geisberger, and I am here today to talk about warming composites, quicker, better, and more efficient restorations. I want to take this opportunity to thank all of you for joining me for this program. And I want to encourage you to look at some of the other programs I've got out there on Viva Learning. I encourage you to follow me on Instagram at Marin Dentist or on Facebook at Mark Geisberger DDS. So just briefly, I need to let you know that I am a member of Catapult Education, a speakers bureau out of Chicago, Illinois, and that tonight's program is being sponsored by Voco. Now, Voco is a company I've worked very closely with for many years. They've gotten a number of great products, and I will be talking about a couple of those products this evening. With that said, I want to thank them for their support for this program and their diligence to creating new and innovative products that work really well in private practice. In addition to that, I work with a lot of other companies, and any product that I endorse or speak on, I currently use in private practice. There's no ifs, ands, or buts about that. I won't endorse a single product that I don't personally use in practice. So with that said, we're going to talk a little bit to start about the science of heated composites. Now, the science of heated composites is actually quite long. In the early 80s, there was some discussion of the literature about articles that talked about the physical changes that occur when a composite was warmed. And from these articles, many clinical techniques were developed. Now, keep in mind, none of those composites were engineered to be warmed, but some had noticed that in warmer climates, composites seemed to perform differently than others. Now, some of the early techniques that were developed actually utilized conventional, at the time, hybrid composites filled at maybe 60 to 70%, heated those up to a near fluid state, well above 155 degrees that we heat to today, and use them for such things as cementing onlays, inlays, and veneers. It was a way of taking a composite, changing its physical properties, and allowing it to do different things for you clinically. Well, from there, the composite warming trends changed, and people started looking at what happened technically to composite. Now, some more recent articles looked at the change in the kinetic energy and greater movement of the particles actually inside composite compared to room temperature. What clinicians and scientists notice is that when you heat a composite, you change the kinetic energy, and that actually made the monomer conversion increase. Now, this was an interesting find. What we've actually found is that warmer composites, when you shine a light on them, actually cure more completely. And you can experience a greater depth of cure. Well, all of that is highly beneficial when we talk about the effects of warming a composite. Now, keep in mind, I practice in California where temperatures live in the 60s and 70s up to the hundreds during the summer. We don't have the brutally cold winters that other parts of our country have. And in reality, that makes things quite different. For those of you who live in cold climates, what you experience with your composites is actually them being quite cold when you're on your practice, say on a Monday morning after they've been sitting in a near refrigerated state for many days, and they'll respond differently. So it's important to recognize that temperature changes to composites do change the kinetic energy and essentially change how they cure and perform. Now, there have been a number of articles that have shown improved marginal adaptation when you compare heated composites to a conventionally room temperature treated composite. And these actually show a number of decrease in voids as well. So it appears in a number of studies that were done in the recent years that these improvements with physical characteristics actually lead to better clinical outcomes. Now, you may ask, wow, how long has he been warming composite? And the answer is for a very long time. I've been using a composite warmer in my practice for the last 15 years for each and every direct restoration I place, and for many indirect restorations. So most of this literature wasn't there when I started this process years ago, but we had a strong foundation for warming composites. Now, research on heated composites also showed a decrease in the water uptake and solubility when you compare it to room temperature composite. That was Castro's study in 2016. Now, Carlos Munoz's research showed that preheating both hybrids and microhybrids actually increased the depth and surface hardness of the composite. What that meant is if you took a sample at room temperature and one that had been heated, cured them both, and then did tests on their depth of cure and surface hardness, oddly enough, the heated composites had cured more completely and had a greater depth of cure. And this is important to recognize that he tested both hybrids, older style composites, and newer microhybrids. Another study showed that that there are some practical issues using heated composite. And this is a real important thing to understand, that really a heated composite will lose most of the benefit after about 2 minutes of removal from the heat source. So what this implies to clinicians is that we've got to work in a timely fashion and capitalized on those beneficial effects of a warm composite. Now, if you want to search some of the literature on heated composites, it's actually quite vast, and there's a lot of information out there. But all of this research supports these improved physical characteristics, these improved handling characteristics, and better marginal adaptation, less voids, which I believe leads to better clinical dentistry. Well, with that said, I want to talk a little bit about the warming units. Now, I'm going to talk mainly tonight on Voco's composite warming options. There's 2 of those, but I will mention some others that I've got experience with and that are well received in the marketplace. Now, to start with composite warmers, Voco has developed a composite gun that actually has near infrared and heat warming capacities of compules of composites they've developed. Now, this is actually quite interesting. This gun sits on a charger that you charge, and then you unplug it and use it hands-free with your composite. And what you do is you load your ampules of composite, and within a couple of minutes, your composite is heated to the temperature of 155 degrees through a program using really any of Voco's composites. Now, it's important to recognize that they have a number of composites you can use in this gun, but the only one truly developed for thermal changes is what's called Viscolor bulk. And Viscolor bulk composite is something I'll talk about tonight. It's a bulk fill composite, but it was specifically engineered to be warmed. Now, that's not true of all composites. Many companies say, sure, you can warm our composite, but we didn't necessarily design it to be used that way. Well, this is a little different. They started with the idea of let's make a composite with the sole intention of warming. And from there, we can develop other products. So the nice thing about this gun is you can put their other compules in there and warm those if you like, if you're using another one of their products, or combine this gun with Viscolor bulk fill. Now, I want to say a couple of things about bulk fills in general. Keep in mind when you're doing a bulk fill, a lot of things have to work properly. The first thing that has to work properly is the dispensing of the material. You've got to ensure that the material is well adapted, free of voids, and that that material will be fully cured. So bulk fills are engineered in such a way to allow that to happen, but they require efficient filling, a near perfect adaptation in all aspects prior to curing, and they require good curing with a light. So your delivery of a bulk fill system becomes very important. And I believe if you're using a bulk fill, 2 things have to happen. You have to have great adaptation and delivery. And number 2, you've got to have full and complete light curing. When you couple those two together, you can have great success using a bulk fill in many clinical situations. Now, the other warmer they have is what's called their caps warmer. And this was developed some time ago to warm all types of composites. But it's important to recognize that the compule that goes with the Viscolor bulk fill composite is designed to fit precisely into this warmer and really shouldn't be used in other warmers on the market. Because of the way it's designed, it fits precisely into the caps warmer here or the Viscolor dispensing gun. So it's important to recognize that both the compules themselves have been engineered in such a way that they warm in both of these situations. Now, what I like about this warmer is you can use any other type of composite and warm it up. It allows you to heat an instrument if you like to have an instrument apply some heat and help burnish things. It also allows you to heat your gun. Now, when you ask me my preference between the dispensing gun, the Viscolor dispensing gun, or this option, I actually lean towards this option due to its versatility. In fact, I can warm anesthetic to give a painless injection to my patients using the same warmer set at a slightly different temperature. So these to me have a little more versatility, but if you like dispensing directly into the cavity preparation with a gun, then you may want to look at the Viscolor dispensing gun. So I encourage you to take a peek at that. Now, there are a couple other brands of note on the market. One is from BioClear. The unique feature of this is not only does it warm to that critical 155-degree temperature like other warmers do, but you can store 2 guns rather than just one. What that means is you don't have to change ampules if you're doing a multiple color restoration. I don't really find a need for 2 warmed guns, but that's one advantage to this. Its footprint is a little larger than Voco's caps warmer or their dispensing gun, but this is a very sound warmer. In addition to that, one I've had a lot of experience with is from Adent, and that is their warmer, very similar to Voco's warmer in that it allows you to heat at 3 different temperatures, 98 degrees, 130 degrees, and 155 degrees. But most of the time when we're warming composites, we really use that temperature of 155 degrees to warm our composites. And that's really important. Now, I do like the feature that I can warm an anesthetic, especially in cold climate times during the year. And when our anesthetic's been sitting in the office, say over a long weekend at 50 degrees, when you inject a 50-degree anesthetic into a patient's 98-degree body, it's not very comfortable. And they won't perceive the pain of the injection going in. They'll actually perceive the pain from the cold as true pain. So think of this as a potential for your practice and providing that for your patients. Now, I use the dispensing gun that's pictured here routinely with my loaded ampule, and I'll warm that up and have it ready to go. Now, the nice thing with the caps warmer, unlike the Viscolor gun warmer, is that you can pretty much set this up in the morning, turn it on, load in a few shades, and you're good to go all day. And that's contrasted by the Viscolor dispensing gun that you really need to turn on just before you're going to use it because it needs a couple of minutes to warm up your composite. And then after a while, it'll time itself back out. So you just have to use that just a little differently. But they're both really nice options for warming composite. Now, I want to show you a clinical case using the Viscolor bulk. Now, it's important to recognize that I chose this case because the patient was in a situation where they really couldn't afford, let's just call it fancy dentistry. They had a very large amalgam, and you can see that kind of shadowing underneath, which to me almost always means decay. And This tooth was pretty broken down, asymptomatic tooth, and we talked about the eventual need for coverage due to, if you look closely, a crack running along the lingual just under that amalgam and on the distal. And the patient said, you know what? I'm sorry, at this time I can't afford a crown. Can you just replace the filling and buy me some time? I said, I'd be happy to do that, but it's going to be a larger than average filling. Not only that, this patient was a bit squirmy. This is the type of patient who drains you, is hard to work on. And when I have a patient like that, the first thing I look for is a bulk fill. Why? I want to get in and get out. I love to layer composite. I still layer composite on a daily basis, but there are clinical situations where I need to be in and out and make it as beautiful as I possibly can. So with this patient, I use an isolite system. That's the isolite in place. It retracts the cheek, retracts the tongue, and we remove that large amalgam. Now you can see a small crack running along the distal, and ultimately this tooth will need some form of coverage. But this is after removal of the amalgam. Now, one thing to be really aware of is a lot of our bulk fill composites, to be able to bulk fill, will end up ultimately being slightly translucent. Now, to counter that effect, there's two options you have. One would be to select a lighter shade, which will, by and large, look less translucent than some of the darker shades. That's option number one. Option number two, and something I will fall back on fairly routinely, is to, especially with these amalgam preparations, line the preparation with a flowable composite first, 0.5 millimeter of flowable composite first. Now, why do I say that, especially with these old amalgams? Because when you take out these old amalgams, you often have these very sharp internal line angles and point angles. And those can be really hard to adapt composite to. So while I could choose to use a bulk fill, and I did on this, I first lined it with flowable just to block out some of those nooks and crannies. And the second reason I did that is it's a little less translucent. So with that less translucency, I'm able to block out a little more of this dark staining from the old amalgam and decay that was present there. So in this case, we use a total etch system. That's my preference in these. So if I'm going to use, say, Futurabond from Voco, then I would use that in a selective etch mode. I'd etch the periphery of the tooth with my gel etchant and then place my self-etching adhesive Futurabond in the prep and utilize that. At that point, I'll place my small amount of flowable just to block things out. That'll help mask that color just a bit. And then it's really important to, before you do your definitive restoration, make sure you have a periodontal probe handy and really measure your preparation at its greatest depth. If it is more than 4 millimeters, then you need to layer. This happens to be less than 4 millimeters, so I'm going to bulk fill this with Viscolor bulk in one step, okay? So I'll go ahead and use that. Now, the nice thing about the Viscolor composite is the way this is designed is as you heat it up, it really behaves more like a flowable. It adapts very beautifully at 155 degrees. But as you allow that to sit for just a few minutes, what happens with the Viscolor bulk is it actually firms up and becomes very sculptable. So in a very short amount of time, I'm able to place this material in and carve it with my instruments and light cure it with very, very little adjustment to do post-operatively. Now, this was then polished with my favorite polishing system from Clinician's Choice called the ASAP polishers. But this was placed in one bulk fill technique and finished back and polished, as I said, very quickly. The composite adapts very well to the cable surfaces and it blends in. Now, the composite itself comes in 4 shades of bulk fill. It comes in a universal shade, a shade A1, a shade A2, and a shade A3. In this case, to kind of counteract the graying from that composite, I did block it just a bit, and then I utilized a lighter shade. Now, I want to talk to you briefly about the isolation techniques that I employ in practice. First of all, I was trained on a rubber dam, and a rubber dam is a great option. It's not for everybody. It's not for every patient, but a rubber dam is a great option. Now, I taught at University of Pacific for 27 years, and I had a mandate as the chair of the department. And I said to students, I'm not so concerned what you isolate with. My bigger concern is that the field you're operating in is always dry and free of contaminants. So if you can accomplish that with a rubber dam, great. If you can accomplish it with an isolite, great. If you can put a tennis ball in the patient's mouth and keep the field dry, great. Just keep it dry. I was never one of these educators who was a zealot about rubber dams, because what I think we created was a generation who completely dismissed them. Here's my point. When you're isolating, find something that works. What do I use in practice? I use an isolite on a daily basis. What I like about the isolite is 3 things. First of all, I get perfect retraction of the buccal and lingual aspect of the quadrant I'm working on. The second thing is it has a built-in support for the jaw or a bite block. And the third thing is I get perfect illumination. And I can change that illumination to prevent the curing of composites. Now, that's really important. If you're using a system that light isn't filtered, the light from a suction device can actually start to cure these bulk fills because they're quite reactive to light. So I really like the isolite system. I've used this literally ever since the week it came out and haven't looked back. Now, there are options that are similar to the isolite. This is one real good option called the dry shield. Now, while it may not illuminate in the same fashion, it does evacuate, it does support the jaw, and it does suction and retract quite nicely. One of the benefits of this system would be that the rubber mouthpieces are actually autoclavable, and that will decrease your overhead by eliminating that disposable nature that comes with the isolite system. Now, you could use a conventional rubber dam or another product that works quite well for simple procedures where you're in and out are called the Neo drives from Microcopy. They really stick quite nicely to the area next to the parotid gland. They're ergonomically designed to fit comfortably for the patient, and they really do prevent that parotid gland from flooding your field. So there's some really good options to look at as far as retraction goes, but you need a dry field when you're doing composite resins. Now, I want to talk briefly about adhesive systems. And what I'll say is this: I've used a lot of different adhesive systems, and all of them perform quite adequately. What I think you have to do is consider the substrate you're trying to bond to, and whether or not you should be using something that's a total etch, a self etch, or maybe even a selective etch. Now, I know there's this big tendency to go to one step, and I appreciate those of you who have had great success with it. But in reality, some of these products in the self-etching may not etch enamel quite as well. So I want you to consider that. Now, the nice thing about having, say, a one-step, so-called one-step adhesive like this, a 7th or 8th generation adhesive, is it's actually more versatile than you'd think. And what I mean by that is you can take, say, Voco's Futura Bond and use this as a one-step or two-step. What it does is it gives me the versatility of being able to self-etch when I want to, meaning if I'm exclusively on denting, doing root carries, then use it in the self-etch mode. But it also allows me to be able to incorporate acid etching when I want that. So I can use it as a total etch, I could use it as a self-etcher alone, and I could use it as a selective etching medium. Now, when I'm on enamel, I want my phosphoric acid. When I'm on dentin, I would prefer a self-etcher. So what makes a lot of sense then in restorations is having some versatility. Now, if you had to default and said, I just want one simple technique, I don't want to change it up, then get yourself a total etch system. However, this allows you to do everything. So I encourage you to look at this product. They've made a lot of significant advances with their bonding with Futuravon U, and their blister pack that it comes in is quite nice and easy to use, very little waste from this product, and it works extremely well. No postoperative sensitivity. Now, why do I mention selective etch? Because in a lot of clinical situations, if you're using a self-etcher, you may see after several years that the enamel margin begins to break down if you used it in the self-etch mode alone. Your dentin bond will be great, but your enamel bond can be challenged. Why? Some of these self-etchers don't quite etch enamel as well as I'd like. So what I do is selective etch. Put the blue gel on the enamel surface and then go ahead and use the product as indicated on the dentin. So when you look at selective etching, there's lots of articles that show some advantageous to that technique. These are just a few if you're interested in reading these, talking about self-etchers versus total etch systems and the benefits of MMP inhibition. I'm not going to get into that because we have a very short time together, but suffice it to say there's a lot of information out there that really supports the use of these products. And I encourage you on your own time to look at these articles and review them as you can. Now let's talk a little bit about the composite I just showed you a clinical restoration with, and that's Viscolor bulk fill. So just to mention, I have had a huge amount of success warming not only Viscolor bulk fill, which is designed to be warmed, but 4 other products I've had a tremendous amount of experience with. And I think it's only fair to mention to you what other products that I have warmed in the past. These are all highly filled composites. They tend to be fairly rigid composites. And when I warm them, they behave differently. The first one here is Kerr's Harmonize. The second one is Clinician's Choice Evanesce. The third is 3M's Filtech. And the last one is Ultradense Mosaic. I've had a lot of experience warming these composites, and I do like how they respond. With that said, none of those were truly designed to be warmed. What I mean is they didn't go into their creation with the idea that they would be warmed. Now, that's also true with a couple of products from Voco. Voco has Extra Base and Admira Fusion Extra, which are great products. But again, they respond very well to warming, but they weren't designed to be warmed. Now, does that really matter? Maybe, maybe not. With that said, when Voco set out to develop their next composite, they said, we want one that is to be warmed, meaning this is the technique you use for this composite. And in fact, Viscolor bulk will not work properly if not warmed. What I mean by saying that is that this composite is designed to be warmed. That's how it's engineered. That's how it was developed. That's how the gun was developed. And it really had that in mind. Why? Because warming is gaining a lot of momentum in the field. More and more practitioners have adapted warming composites. They like how they feel. And Voco felt it important to develop one exclusively for that. Now, with that said, this is not dissimilar to many other composites in that it has a very high filler content. So at room temperatures, this composite would be quite stiff. When it's warmed, it's quite fluid. It has high compressive strength, like many conventional composites, like Admira Fusion and others. It's extremely low wear, and it has very high Vickers microhardness. Well, that's true of most microhybrids. With that said, this is a bulk fill, meaning it can be cured in up to 4 millimeter increments. Now, what happens to this technology that was developed, and they call it thermoviscous technology, and it's basically a way of coating the silane, which assists the monomers in dropping their viscosity when warmed. So this is really the science of developing a composite that really changes when it's warmed. And what happens with this, as you warm it, it really becomes quite fluid. So that application temperature is up to almost 155 degrees, which your cap's warmer or your Viscolor dispensing gun will be heating to. You'll place that, and really within a very short period of time, what happens is the viscosity changes back to a relatively carvable or sculptable composite. And then you go ahead and shape it, clear the excess, and light cure. But that application phase makes this very easy to adapt to the axial walls of preparations, makes it very easy to adapt to the cavo surfaces via restoration. Then you let it sit for just a few seconds. As it loses that heat, it becomes more sculptable. Now, this looked at some other composites that did not undergo as much of a viscosity change as this one designed for this warming technique. So its filler content, as I mentioned, is 83%. That's really comparable to most other things on the market. Remember, the higher the filler content you get, the more rigid the composite becomes. It becomes a little more rigid, a little better wear characteristics, a little less shrinkage. So things improve as we keep that filler content quite high. In addition to that, it has very low volumetric shrinkage. And this is important when you consider what else is out there on the market. But suffice it to say that most well-designed composites today, and the vast majorities live right around 1.5 to say 1.8%. To get below 1.5% is actually quite an accomplishment. We're not going to see much better than that in the marketplace just due to the chemistry of monomers and polymer chain formation. But to see really anything under that 1.8% is quite an accomplishment. And most of our composites now live in that range with a few exceptions. Some of your older style composites, the hybrids, still shrink quite a bit. So it's important to recognize that they've engineered this to be a very low shrinkage composite. Now, this composite comes in a universal shade, A1, A2, and A3, as I mentioned. Now, here's a tip when you're using a bulk fill. If you're between shades, you're going to go ahead and default to the lighter of the two shades. That's tip number one. If the tooth has got a lot of color underneath, you may consider masking that out if shade and final look of the restoration is important with something other than the material. Now, the universal composite itself in the Viscolor bulk cures in 10 seconds. The reason it does that is it's actually a little bit more, slightly more translucent. And as such, it will always appear slightly grayer or translucent, but you have the benefit of curing that 4 millimeters in 10 seconds. If you've got an extra 10 seconds to spare, I'd suggest using A1, A2, or A3. And most of you could probably live with A1 or A2 for the better part of your career. Only those super dark, occasional A3 posterior teeth would require that. But that A1, A2, and A3 cure not in 10 seconds, but they cure in actually 20 seconds. So it's important to recognize. Now, I mentioned earlier the importance of using a periodontal probe. And a periodontal probe, I believe, should be part of your operatory setup for all posterior composites if and when you're considering a bulk fill. Because most of the bulk fills on the market are designed for about 4 millimeter depth of cure. Now, it's important to realize that sometimes when you're in a class 2 situation, say, and you measure from the depth of the box form you've created to basically the height of the marginal ridge where you intend to restore, you're often greater than 4 millimeters. And I think what happens, and the reason we see so many issues with this technique of bulk fills, is number one, the composite may be undercured, not because of the product itself, but because the clinician failed to recognize the need to measure that depth. That's reason number one. Reason number two would be actually improper curing with a light that may not be functioning properly. And I will touch on that in just a bit. So I think it's important to recognize that you need that to ensure that you've got that 4 millimeters. Now, the restoration I showed you earlier was actually measured at about 3 millimeters in total depth after I had placed my liner to mask out that deep color. And that was more than a go for this product, and it worked beautifully. Now, one thing that you'll appreciate if you get an opportunity to use the Viscolor bulk is that it really behaves like a flowable. The second thing you'll notice is that the ampule you deliver with is actually got a very thin cannula, which is great for getting into your more conservative preparations. It's not going to be a big old opening like most conventional composites. Why? Because as it's heated up, it can actually flow through these thin little cannulas. That makes it very accessible. Now, this uses not only uses near infrared energy, but heat as well. So it's important to realize that this is being warmed through 2 bits of technology, through a computer program running inside the gun and inside our dispensing machine, the caps warmer. So it's important for that to be recognized. Now, the nice thing about this, and what I appreciate most, and I want to draw this very important distinction, is that if you get a bulk fill that is a flowable, when you squirt it into the preparation, you're squirting it in at room temperature. What that means is its handling or viscosity never changes, meaning it is always a flowable. The biggest problem I've had with bulk fills up until now is that bulk fills that were flowable could not be carved. They couldn't be shaped properly. And they ended up looking like someone stepped on the tooth with their thumb. So the reality is, this technique allows you to have the benefit of a flowable feel to your composite, but then after the temperature dissipates, the restoration becomes oh so carvable, which is a really big feature of this type of product. So I want to talk just a bit about your restoration, placement, and curing. It's important to recognize that this, for me, is the second most important aspect of what we do in the restoration phase. Of course, the placement and making sure you have good marginal adaptation, good void disbursement, no voids in your material is of the utmost importance. But then good curing is critical. Now, this was a very interesting study that was done actually quite a long time ago. And I always bring up this study because of the importance it had on my practice. So the Journal of Dentistry published this article by a young practitioner who went into 57 dental offices in their practicing area, meaning around their community, and just asked the docs if they could test their curing lights. So during the study, the clinician tested 101 curing lights. Now, keep in mind, this is 1999. We weren't using LEDs, we were using halogens. But what this practitioner found was that only 43% of the lights that they tested rated satisfactory for curing at the prescribed curing length of time. And at the time, that was 40 seconds per 2 millimeter increment. What they also found is that almost a third of those curing lights would require additional curing time. Now, the scary thing was that 28% of the lights being used by clinicians were completely ineffective. Now, I read this article in the Journal of Dentistry because I was at the dental school full time as an educator and in practice just 2 days a week. And I read the article and I went back to my father and brother who I'd been practicing with and said, hey guys, when's the last time we checked our lights? And the answer was never. So I said, I think it's time we buy a radiometer. And we purchased one, tested our lights, and we had 7 operatories with lights in them. And what we found was the exact same thing, that a couple of our lights were functioning just fine. A couple others had lower than adequate energy to cure in 40 seconds and would require extended curing time. And we also found that a couple of our lights that were completely useless. Well, what that instituted for us is a policy that is now almost 20 years old. And that is that every light in our practice is checked monthly for its output. We own an LED radiometer that's pictured here from a company called Demetron. That radiometer allows us to check for output of every light on a monthly basis. We have one of our dental assistants as a routine, the first of every month, going to every operatory and test those lights. Now, you can buy these for LEDs. There are also others, more sophisticated systems that allow you to actually test your own lights and then test them with the composite you're using and tell you exactly, precisely how much time you need for each composite and each shade. Well, I think that's a bit overkill, but the idea is sound. We need to test our lights. Don't just assume because your light is cranking out blue that it has enough energy to actually get the job done. So that's important for you to recognize. Now, the Cellulux 3 is Voco's light. It outputs at a high intensity energy of 1,300 milliwatts per centimeter squared with that wavelength range of 450 to 480, really designed to cure camphorquinone. It indicates how much time has elapsed by a little vibration. So you get that as time goes by. And the nice thing, it has that autoclavable tip that makes it very, very effective. The light I've got a lot of experience with is the Velo light from Ultradent. This light, I have 3 curing modes, and I have 4 LEDs with a wavelength range of a little broader at 380 to 480. And the reason they designed this light that way is to be able to cure multiple different photoinitiators. Camphorquinone, which cures at 465, PPD, which cures at 445, and TPO, which cures at 405. Now, with that said, very few products actually use TPO. Why? It's under patent protection by another company. But you see these other photoinitiators used quite frequently. The reason the PPD will be used is it tends to be white, and it's used in lighter shade of composites, because if you use camphorquinone, which is orange or yellow in color, you can't use it in the real light shades. So most companies will mix a little of different photoinitiators in there. Now, while PPD likes 445, it'll cure at a very broad range. So most curing lights will cure 99.9% of what's available in the dental marketplace right now. With that said, the Velo curing light is designed to cure a few additional products that are available on the market from a few select companies. Now, I can use my curing light in different intensities. I can use it in a standard mode, 1,000 milliwatts, which is where I normally live. I can move it to a high power mode, which will cure in 3-4 second cures for a final cure, or I can go into a very high energy mode for 3 seconds. I don't go there all that often, although I will when I have a situation where I got to get in and get out. And I have a very small volume of composite where I'm not worried about shocking the system. So I'll use that, say, for sealants and children who are squirming all over the place, and I just can't keep them from moving. So that's a real good application for a high energy output. But really, you live in the 1,000 to 1,400 milliwatt mode. Now, I really want to encourage all of you to look into testing your lights on a routine basis. I think that's really important. And that becomes really critically important when you're considering the use of Viscolor bulk as a bulk fill, because you want to make sure your lights are functioning properly. One thing you can do is call in your local rep. They have a radiometer and they'll check your lights for you if you don't have one. Or do what we did, make the purchase, a couple $100, buy yourself an LED radiometer designed for your wavelength, and test your lights routinely. Now, to finish up, pardon the pun, I'd like to talk briefly about contouring, finishing, and polishing. And for me, this should be kept very simple and very easy. I don't have a lot of armamentarium for this. What I do use is a couple of things. First of all, I use Microcopies Neoburs. These are fluted disposable carbides for finishing and contouring of composites. And I like these because I can get the job done quite quickly. In addition to that, I'll have a polishing system. And as I mentioned, my favorite polishing system, and one is really the only one I use, is a 2-step polishing system from Clinician's Choice called the ASAP, or All Surface Access Polishers. It's a 2-step system. They're autoclavable up to about 30 times, and they do create a very beautiful luster on your composite resin restorations. So it's a real nice product for polishing. I encourage you to give them a try. They have an embedded 44 micron diamond impregnated rubber component that does the initial polish, and then you hit it with a 3 to 6 micron diamond particle polisher that gives your composites a beautifully high luster. And this whole process takes no more than 30 to 40 seconds to establish a beautiful polish. The other thing I'll say about these is they don't really obliterate your anatomy because of the design of the wheel, whereas a cup or a disc will tend to obliterate or flatten out the anatomy you've built into your restorations. Well, with that said, I finished just in time to answer a few questions and thank Voco for their development of this very unique bulk fill product. I want to really encourage you to explore composite warming, look at the literature, give it a try. Once you do, and you use Viscolor bulk, you're not going to turn back. So with that said, I'm going to look at a few of our questions and see if I can answer some of the questions. So I get one of the participants asked me a question about the amalgam that I restored. Was it asymptomatic? And the answer was yes, that tooth was asymptomatic to the patient, even though there was the presence of a small crack running down the distal. But that crack was mainly in the enamel, which you see in aging teeth. So they remain asymptomatic. It was fine. The next question is, can you warm Grandio SO? And the answer is you can warm anything, but the reality is a lot of composites may not have that as an indication. So it's important to check with your manufacturer. But yeah, I've warmed that composite as well as many, many other composites. So Dr. Sean, thank you for that question. Next question I have is, any experience with cementation tabletop crowns? And I have had that. And using a warmed composite, even a warmed resin cement, is a very good idea for that type of restoration. So when you're doing that, it's important to recognize that technique with the tabletop crowns really would benefit from warming, because you'll get the nice fluid tendency of your resin, and you'll be able to cement that just fine. Now, the next question comes from Nada, and Nada wants to know what the optimal temperature is for the warm composite technique. And the optimal temperature set by most of these composite warmers is 155 degrees Fahrenheit. Now, that's for a conventional composite, not a flowable. If you intend to heat up a flowable, which you can do, you'd want to actually heat that at the second setting on, say, Voco's cap dispenser, which would be 130 degrees. But when you're warming up, say, Viscolor bulk or other composites, you do that at 155 degrees. Okay, the next question I have, are self-cured composites do better regarding shrinkage? And the answer for Dr. Sean is not necessarily. Remember, whether you're curing with light or curing with a reaction that's driven by a chemical reaction, you're taking monomers and creating polymer chains. And when you do that, all resins will shrink, regardless of their mode of curing, whether they be a light-assisted curing or a chemically assisted curing. So my next question is from JC, and JC asked, what is the universal shade like? Well, the universal shade with Viscolor bulk, it's really kind of A2-ish, but I'd say it's a little more A2-ish translucent. And the reason being that way allows it to cure in that 10 seconds. So that's for someone who really needs to get in and get out. Now, I like my restorations to look as lifelike as possible, so I'm willing to invest that extra 10 seconds with the Viscolor bulk A1, A2, or A3. So I think that's a real valid question. So I'm just looking through a few more. We've got just a couple of minutes, and I'm going to go through a few more of these because they're great questions. Do you recommend any other heating tools for composites? And other than one that's really been designed for heating composite, I don't really recommend them. Why? It's really hard to control the temperature, and more importantly, it's hard to control the evenness at which you've heat temperature. Now, I've heard some people have used things like plug-in coffee cup warmers. Well, the problem is if you put an ampule of composite on top of that, you'll heat the bottom, but the top, the furthest portion away, will not get heated. So all of these composite warmers work very similarly in that they surround the ampule or compule of composite with uniform heat, making the entire product consistent. Dr. Singla said thank you to me, and I say thank you for the thank you. That's very nice of you. Robert asked me, do you ever use air abrasion to get rid of amalgam stain? And I have used that, especially around cabo surfaces, and it works quite nicely. In that deeper dentin amalgam staining, I haven't had a lot of success. But yes, Robert suggests using air abrasion. And I believe around the cabo surface, Robert, that's a great idea. Salma asked me, do you use flowable composite as a base of deep restorations? And the answer is, if I am doing a layered technique where I'm really focusing on optimized aesthetic results and I've got a lot of time to spare, I will line with a flowable. I also use a flowable, relatively opaque color flowable, say a dentin shade flowable, when I'm trying to block out dark tooth structure. Because remember, when we're going to use a bulk fill, these bulk fills are relatively translucent, and that will allow some of that color to come through. So those are the applications where I would use a flowable composite. And that's important. So what carving instruments do you use? Well, that's a great question. And the carving instrument I use exclusively on composites is from Clinician's Choice, and it's called the REJ10. Robert, and that's named after Dr. Jordan. The Jordan number 10 instrument. It's got a spatula on one end, and it's got a little condenser / carver on the other end. The other instrument I use routinely to get my little grooves in composites is actually a Pigtail Explorer. So those are my two primary instruments for composite restorations. Valeria asked, did I show the code for attendance? I don't do that, but you'll get that shortly. But thank you for the question. Any sensitivity issues after heating, after placing heated composites? And that is a really important question. And I want to thank you for asking that question. And the answer is I haven't had those. And the reason being is, keep in mind that 155 degrees is not all that warm. And that, when placed on the tooth, will begin to cool very quickly. So I haven't had sensitivity issues followed heated composites, and I've been doing heated composites for a long, long time. Any other composites it's okay to heat? And I would say, you know, if you're cautious and using them properly, you can heat other composites. Will all composites cool to be carvable, or is that specific to Voco? Well, most of the composites will cool back to their initial state. So if they were very rigid, they'll be rigid when they cool back down. But Dylan, that question's important. What'll happen is most of them won't get to as fluid a state as the Biscolor bulk. They'll get softer and creamier, but they won't get fluid. But they'll all return to their original state. So Quinn asked, for the tooth with a crack line on the distal, would you consider prepping it for a DO? And Quinn, I would say absolutely, especially if the patient reported any signs of discomfort to biting on that side of the arch. They had not, so I didn't do that. But yes, that's a very valid approach, and I wouldn't hold that against you if you said, you know what, I'm turning this into a DO. I think you'd be just fine in doing so. Marco asked, do you use anything on composites to improve the oxygen-inhibited outermost layer, glycerin? Well, I really don't, but that is a valid technique. I think that's more important when you're trying to, say, seal the margins of a tooth. You could use a little glycerin on an on-layer or veneer, which I do fairly routinely, but I don't do that for my conventional composites. And then Dr. Alexander asked about any risk to thermal damage to the pulp. And I haven't experienced any thermal damage to the pulp personally, nor have I seen any reported in the literature from heated composites. But thank you for that question. Well, with that said, I'm going to call it right there. I want to thank you all for attending my program. and encourage you to listen to my other webinars, especially the oral cavity under acid attack. If you can find that one, it's really fun. With that, I bid you farewell.